Let me start with a question I hear all the time in my clinic, but almost never in a clear, confident voice. What actually happens to your body if you ejaculate every single day? Not just once in a while, not occasionally, but day after day, year after year. Does it help you stay healthy? Does it quietly drain your energy? Does it protect your prostate or irritate it? Does it affect your hormones, your mood, your motivation? If you're a man over 60 and you've wondered about this, even privately, I want you to know something right away. You are not strange, weak, or inappropriate for asking. You're human and you deserve honest answers. I'm Dr. Thomas, a urologist with 10 years of experience working with men who want to age with dignity, clarity, and confidence, not confusion or shame. And today, I want to talk to you the same way I talk to my patients when the door is closed, the pressure is gone, and honesty finally shows up, not as a lecture, not as a warning, but as a conversation between two adults who respect the body and the years it's carried us through. Because here's the problem. Most men have been fed extreme advice their entire lives. One side says, do it as much as possible. It's healthy. The other side says, you're draining yourself. Stop. And neither side tells you the full truth. Before we go any further, let me ask you to do something simple. If you appreciate honest conversations like this, tap the like button. It helps more men find this video. Drop a comment telling me where you're watching from. I truly enjoy reading them. And if you haven't subscribed yet, hit subscribe, because this channel exists for conversations most doctors never have time to finish. All right, take a breath. Let's talk about what daily ejaculation really does to the male body. Let's clear the fog. First, you've probably heard at least one of these statements in your life. Daily ejaculation lowers testosterone. It weakens men as they age. It's bad for your prostate. If you stop things, stop working. Real men shouldn't need it after a certain age. Here's the truth, and I want you to listen carefully daily. Ejaculation is neither automatically good nor automatically harmful. What matters is how your body responds physically, emotionally, and hormonally. Let me explain what actually happens inside your body. When ejaculation occurs, your brain releases dopamine, the motivation and pleasure chemical. You also get oxytocin, which promotes calm and connection. Endorphins help reduce stress, and afterward, prolactin rises, creating that relaxed, settled feeling. Your heart rate increases slightly, blood flow improves temporarily. Your pelvic muscles contract and release your prostate, empty stored fluid. All of this is normal. All of this can be healthy. In fact, for many men, regular sexual activity can support circulation, reduce stress, help sleep, and maintain prostate function. But, and this is where age matters, recovery changes. As we get older after 60, testosterone levels are naturally lower. Muscle recovery slows. The nervous system becomes more sensitive. Energy reserves take longer to refill. So if stimulation happens too frequently, without enough recovery, the body can start sending signals, not shame signals, not moral signals, biological signals, fatigue, brain fog, irritability, lower motivation, pelvic discomfort, urinary changes. And those signals are not punishment. They're information. The mistake most men make is ignoring those signals, or worse, judging themselves for them. Which brings us to what I see every single week in my practice. Let me tell you about two men I've treated, both in their 60s. The first man tells me he's intimate, almost daily. He sleeps well. He wakes up calm. His energy is steady, no discomfort, no urinary issues. For him, daily activity isn't a problem at all. The second man tells me the same frequency, but a very different story. He feels drained afterward, less motivation, pelvic tightness, more nighttime urination. Same habit, different outcome. So I asked the most important question I know how to ask. How do you feel afterward? Not immediately, but later. That's where the truth always shows up. There is no universal rule, no magic number, no moral line. There is only feedback. And when men learn to listen, not judge, everything changes. So let me walk you through the 5 most common habits and mistakes I see in men over 60 when it comes to daily ejaculation. And stay with me, because the final one has nothing to do with biology and everything to do with dignity. Mistake number 5, confusing habit with desire. This one is subtle true. Desire comes from the body, hormones connection, emotional readiness. Habit comes from routine, boredom, or stress relief. When activity becomes automatic, dopamine response dulls. The brain expects stimulation rather than responding to it. Biologically, this can reduce satisfaction. Emotionally, it can feel empty. Practically, it can lead to going through the motions. Solution: pause occasionally, let desire return naturally. Mistake number 4, using ejaculation to manage stress or loneliness. Many men don't realize this shift has happened. Instead of connection or desire, the behavior becomes a coping tool. Dopamine temporarily masks stress, but never resolves it. Over time, satisfaction drops, frequency increases, guilt quietly grows. Solution: ask, what do I actually need right now? Sometimes the body wants rest. Sometimes the heart wants connection. Sometimes the mind wants purpose. Mistake number 3, ignoring prostate feedback. Yes, regular ejaculation can support prostate health, but more is not always better, especially with enlargement or inflammation. Daily stimulation can irritate an already sensitive gland. Biologically, the prostate needs time to refill and calm emotionally. Discomfort reduces confidence. Practically, urinary symptoms worsen. Solution: for many men, 2 to 4 times per week is the sweet spot. Mistake number 2, overworking the pelvic floor. Your pelvic floor is muscle, not a switch. Daily contraction without recovery can cause tightness, weak control, reduced sensation. Solution: rest days plus gentle strengthening. Kegels matter, especially now. Mistake number 1, letting shame and old beliefs control you. This is the most damaging mistake of all. Shame increases stress. Stress lowers testosterone. Lower testosterone affects mood, energy, and desire. There is nothing wrong with desire at any age. Health is alignment, not punishment. Your simple action plan: track how you feel afterward, adjust frequency, don't eliminate pleasure, support recovery with sleep, hydration, nutrition, strengthen pelvic floor, gently release shame. It harms more than any habit. I want to say this clearly, and I want you to hear it without judgment. If you felt confused, if you've worried something was wrong with you, if you felt embarrassed even thinking about this, you are not broken. You are not weak. You are aging and adapting. I've seen men in their 70s regain comfort, confidence, and peace simply by listening to their bodies instead of fighting them. Aging is not the end of vitality. It's the beginning of wisdom. Small changes create more energy, better sleep, clearer thinking, stronger confidence, and you deserve every bit of that. If this video helped you, do me a favor, hit like, comment where you're watching from, subscribe, so we can keep having honest conversations. I'm Dr. Thomas, and I'm here to remind you your best years are not behind you. They are built one respectful, informed choice at a time. Take care of yourself. You are worth it.